Namaste. I am Dr. Dinesh Gupta. I am a homeopathic physician and I am practicing since 25 years. I am making this video with an appeal to the entire medical fraternity regarding this coronavirus. After much of study and seeing things what is available on the internet, the authentic sources, I have come to the conclusion that the genus Epidemicus for this coronavirus is a remedy veratrum viridi. See, I would make an appeal to people around the world who are in the influential position, doctors, nurses who are having the opportunity to work in the ICU. I feel this remedy will help. See, there are you can see the Italian Prime Minister saying that we have been trying everything and now we are looking at the skies. I would request any person, when there is no scope, when you have tried everything, please try this thing. It is a homeopathic remedy and it should be given in the highest potency which you have. But any potency will do. You have to give the 1 ml. You just have to give 4 or 5 drops to the person. Just once, you please give it once only. And then you can see the effect. I feel you will get result in 60 to 70% of the people with this remedy. After, if you are trying, I am just requesting people, if you can do whatever treatment you want, but if you are not getting any result, please try this. Whatever I am telling you, you will not, people around the world, you will not lose anything. When the person, and this remedy will work best in people who are young, under the age of 50 years, and I feel 60 to 70% times you are definitely going to get result with this remedy. And after the prescription, suppose you are trying this remedy in the patients, this remedy is not for preventive purposes, please. I am talking about patients who have tested positive and who are having very severe symptoms, who are in the ICU. This remedy is for those people. And I feel definitely it is going to work. So you please try, I am just telling you to try in 10 to 20 patients, you will not lose anything. At the most what will happen, you will not get any result, that's all. But if you can try hydroxychloroquine, which is an anti-malarial in a viral infection, without any explanation, why not try this remedy? Please try this remedy, and after giving of the remedy, there are chances that your person might vomit. Don't suppress the vomiting. Please, most of the cases, what happens when the virus invades your body, it brings about changes in your body. It produces toxic material and the body tries to eject it out by vomiting, by loose motions. So one should not use antiemetics in these cases. And people around the world, they are just complaining that we don't have enough of ventilators, In my 25 years of practice, at least I haven't seen a single patient returning back from the ventilator. Okay, so you live unless, please, I am requesting the doctors, it is so much logical, when patients develop vomiting, when they develop diarrhea, it is the body's way, it is the mechanism of the body to get rid of the toxin. The dyspnea and everything, what happens, you are just prescribing antiemetic, you are just blocking everything which should come out of the body. And frankly speaking, nobody knows exactly what is going on. And it is just what, people want to do something for themselves. So they try in the same way the doctors are also trying. To prove my point, I am adding this small clip. This is the real, what the patient is telling, that is the reality. In this clip, you see the clip, what the patient is telling, you feel better when you vomit. And the more you sleep, the more chances are that your lungs are going to get paralyzed. So vomiting should not be suppressed. At the most, what will happen? The patient will go in dehydration with 1 or 2 or 3 vomiting? No. And in the clip, he is also telling, that he has told very frankly, and that is with experience, he has told that, you have to breathe on your own. He is telling, don't be dependent upon the ventilator. So please don't complain that your country is not having so many ventilators, there are so many patients. No, please try to survive. Again I will request, again I am appealing, please try the remedy Veratrum viridi. I am writing the name and you can reach to me anytime. See, only giving of the remedy you will get result. 60 to 70% of the cases should get result with this remedy. And if we get result, the rest cases also can be managed. But the thing is trying it. Please try, if you don't have any other way, as you are trying so many things, I would again appeal the medical fraternity to please try a remedy, Veratrum viridi. At least give once to the patient. Just 3 or 4 drops directly in the mouth. Namaste. Please have a look at the clip. Whatever I have told you, to make my point clear, please look at this clip, how the patient is describing, and that is the real thing. Thank you.
It was all go. It was bad.
Did they tell you in what critical condition that it put you in that bad of a condition? Why don't you tell me about how you felt, Kevin?
Well, actually, I run an elliptical for an hour every day. And my diet is really strict. I don't drink. I don't smoke. I've never done drugs of any kind. I'm super healthy. Even my heartbeats per minute at rest are 40 beats per minute.
Oh, wow.
So I'm in pretty good shape. And the virus was like, oh, I'm going to fix you. You think you're healthy? Let me show you what I can do to healthy people. And it started turning my lungs to glass.
That is such an incredible way to describe it. Go ahead.
The more I rest, the sicker I got. And it's really weird because it lets you feel better when you lay down, when you breathe slow, but the whole time your lungs and your body is defeating the whole purpose. You start to turn to glass and it crystallizes and more of your lung capacity is taken away from you. But when you get up to move, your air drops to half, your air consumption, you choke, you throw up, the pain, the headache, everything comes back when you move. But that's what keeps you alive. It helps your immune system to fight back. But the virus makes you feel good about laying down. It's almost like a high because you get this feeling that I just want to lay here forever. But if you breathe, you're getting less and less and less oxygen. And sooner or later, you're going to go into respiratory failure and cardiac arrest. So they
make you get up then?
Oh my God, yes, they make you get up. And when they make you get up, you throw up, you cry like a little baby. And I can remember the first time it happened. After I threw up, I could breathe. So the next time around, I tell the nurses, no matter how much I beg, do not lay me back down. Make me go through it. It takes about 20 minutes to go through one of those episodes. But once you get to the other side of it, you can breathe a little bit better. I mean, it's the weirdest thing. You think you're going to die during one of those episodes. You know you're going to die, but then you don't. When just the opposite, when you lay in the bed, the fever goes away, the headache goes away, the body pains go away. You feel this relief come over your whole body, and it's killing you.
Wow. Kevin, I have never heard anybody explain these episodes as well as you just did. Now I can see why there's such panic and alarm about ventilators and why people need ventilators and they're afraid they don't have enough in the hospital system in the United States. Did you have to be on one?
No, they did everything they could to keep me off a ventilator. And that's, another one of those misconceptions. I know they're only trying to help and keep people from panicking. But if you don't breathe on your own and your immune system does not kick in, you are going to die.
Kevin, I think that your words can be a big wake-up call for a lot of people who